activate the scapula, you work all that stuff too. And in a further consecutive session, we can go more into specific trigger points of these specific muscles, and then you get, you know, a more comprehensive workout, a more comprehensive idea. So we're going to be specific if that problem shows up. Okay. So what I want you to do is try that on that side. Oh, before I do that, let me make one more note, because I often put my knee up because it just helps me over the body more, which is totally fine. What you don't want to do is you don't want to lean into the patient.
Okay.
So that's the challenge with that. So just be aware of that if you do that. And often I bunch up the towel a little bit so they have a little slack, it doesn't pull on them like that. It's just a few tricks to pick up along the way. Feel the crest?
Yeah.
So that's the pelvis there, that crest, and right at the top of it you got that muscle. You feel that muscle?
That's like right here.
There's some tensor points right in there. Yeah, and they often occur as we get more close to the midline. Because there's a lot of muscles in there, and the low back is tense in many people. So many people don't treat their low back well, or cannot treat their low back well. Because, for example, sitting is really hard on the low back.
Don't you feel stiffness right here?
You feel that? Yeah. So now we're going to just go up this. Oh, actually, you can work a couple of points along the line there. So you slow it all down. And then you, yeah, keep going, sorry.
Well, how does this feel?
You can give more pressure.
Okay.
But you're right in the right spot.
You feel it give a little bit after a couple of seconds and a couple of breaths to it, and then you can go a little bit deeper to match it again. That feeling all right, Rob?
Mm-hmm.
Good.
How about that pressure there? Is that good?
Yeah, it's perfect.
Okay.
And often, once you work one point, you back off a little bit and then you go back into it. So like when you go up the spine. I think you did that, it just wasn't verbalized, so I want to make sure I say that as well. And then you just riding on the cable a little bit, right? You feel that?
Yeah.
Does that feel good, Rob?
Yes.
Because that feels generally, that's the patient wants that muscle work. The cable muscle, he or she wants that work.
Oh, I feel it coming up on another one right there.
That's right.
On my back thumb.
That's right.
And how does this feel?
Good.
Okay.
Very top of it.
Okay, and how about the pressure? On a scale of 1 to 5?
You can think about 3.
Okay.
So with this breath, you can go a little bit deeper. That's good. Matching the breath is his breath is, or the patient's, the customer's breath is a very good way of being in tune. Working with the breath. Because you're going to stay focused on the person and not wander off anywhere. You know, you got to consider you want this person to sleep on the table. So you got to make sure you're not going to sleep. Or I got to make sure of that. And I do it.
You felt a little dense. How's that from?
It's a good spot.
Okay. Is it comfortable?
Mm-hmm.
Okay.
So as you move up, your thumbs might get a little tired. Right? That's one reason why I want this to be stable, and you're doing it great. I'm just talking about it. And the movement coming out of the trunk. Because you can maintain a stable contraction much longer than moving. You can sort of lock the muscle in. Good. Then you go up to the side up there. That's excellent.